Kenya's dependence on external support for health, especially from major donors like Gavi, faces an impending challenge. By 2029, Gavi plans to phase out financial assistance, necessitating a shift towards sustainable funding strategies.
Our partners like Global Fund and even PEFA are now waking us up and saying, you guys, we may be leaving soon. And for us to leave, for you to continue, you must strengthen your systems.
The health sector needs more financing, but a huge proportion of our investments need to go to health promotion, ensuring that we are preventing diseases.
With 80% of health services at the community level, Kenya's disease prevention and health promotion strategy appears promising. However, 22 years post-Abuja declaration, the health sector struggles to secure the recommended 15% of the national budget. Presently, the health sector operates on a 121.1 billion shilling budget, while UHC operates on a 43.9 billion shilling budget.
The way to do that is to really look at, out of the 315 primary care networks needed across the country, and how many are established. Out of those established, how functional are they?
While increased health funding to operationalize universal health coverage is achievable, a detailed sub-sector allocation plan is important.
Most of our budget, it's like lump sum, public health or medical or preventive. Within that preventive, we need to see a separated budget line and with the cost. And that cost must be informed by the need. Like for example, under HIV, what is our need? What is it that we have? Where is the gap?
The call for a sustainability plan grows louder as stakeholders express concerns about the current trajectory.
Imagine if we could cut the occurrence, reduce the occurrence of diseases like diabetes, high blood pressure, cholera, diarrhea, malaria, HIV to be 1 out of 10. Then we can afford. But at the current rate, I can tell you, it's only a matter of time before we realize that our health system cannot break even.
Dr. Stephen Mule, African Parliamentary TB Caucus chairperson, anticipates increased health financing in the upcoming fiscal year, but stresses the need for improved county accountability.
Once they receive the block money, the amount of money which goes to the health sector is very little. We are not saying that we want to micromanage counties. What we are saying is that, can you give us a sense why we cannot ring-fence the money?
When we begin the budget making process, do we do analysis of the current one that we have? Did it give us a result we wanted? No. So do we still commit more money? Do we reduce or do we add?
With President William Ruto set to implement universal health coverage in January 2024, the social health insurance, formerly NHIF, is poised to be a key financier.
Every Kenyan, even those who today cannot afford nothing, they will have a health insurance. The people who are paying 500 will come down to 300.
That will be key to see how the spirit of NHIF will be looked at in that budget. And we'll be keen to see, once the budget policy paper comes to the House, how it is.
The urgent need for increased health funding in Kenya is evident as the nation faces the challenge of transitioning away from donor dependence. The upcoming budget must therefore reflect a comprehensive strategy to ensure the sustainability and success of universal health coverage. Ben Kerera, K24, Health Beat.